see if I can minimize, like, how, let
Yeah.
me see if I
Do the
can,
3
more options.
remove from the cell.
No, if I remove it, then I
He
think
ends.
that it might end.
Okay. So in order to post this as a podcast virtually, we have like the little like recording on. So it's okay. She can basically like, we'll come in
I
close like
know.
this and see us.
Sorry, we were waiting to figure out what this would look like as more people joined.
Mm-hmm.
But I'm wondering.
Okay, and I have quite the bio introduction for you. Okay, so it's going to take me a minute, and then we'll go on and start by asking you a few questions.
I'm trying to look at me here. I'm sorry, I was just going over the questions.
No, we'll wait. We've got a little bit of time here, so I'm gonna mess around to see if.
Oh yeah, it's quite narrow. Like it's just.
Yeah, let me see if I can change the layout.
Let's worry about the background.
Your hair looks good.
Thank you. Your hair looks so blonde.
I know.
It looks nice.
Summer. Well, I have so many grays now that it was just, I was having to go like way more. Oh, there, that looks better.
This looks better, or there's this where it's whoever is
Oh yeah, I'd like to have Deb as like the.
Okay, then you want to do this one?
Yeah.
Okay.
Okay, now can you see us better?
Well, I can see Christina, but I can't see you.
Oh, really?
If you may have to change the layout on your screen
But
as well.
as long
Okay, because I do see there's a big gap between, like I see you on one side, me on the other side, then there's a big gap with nobody.
If you do more options, there's 3 dots at the bottom and it'll say change layout, and then you can change the layout to whatever view is best for you.
I see, change layout.
And then whatever is easier for you to interact, but that way this when I
But
start recording will be.
Our video will show just her then?
Our video will show this.
Okay.
Like, and then again, it won't show my tabs or anything.
So what I see now is I see the full view of me in a little tiny box in the bottom, and then I see a full view of you.
Okay.
Is that better?
It is better, except I just see Jennifer from nose up.
Oh.
This
Well,
is
I don't know, I'm just telling you what I see. I don't know if it's right or wrong, but.
So for our perspective, like we have what we need. If you don't care about looking at my nose while I'm talking to you, we just need to be able to post what we're seeing on our website for the podcast.
Okay.
Okay, so we're already recording, so we'll just have Hannah kind of edit this out, this pillow portion, this fixing portion.
Perfect. Okay.
So hi, welcome to JLox's podcast. We're really happy that you would join us today. We have Dr. Deb Matthews here, and I have quite a bio that I'm going to go through for her. So she is an author, a speaker, an educator, a wife, and a mom of 4 boys. She focuses on restoring your health, addressing root cause of the problem instead of just treating the disease with drugs. She's considered an expert in her field. I actually trained with her through the BHRT Training Academy, and then I went to her lovely office in the Carolinas there, and we saw her beautiful office that she works out of. She's an author to 2 best-selling books, This Is Not Normal, A Busy Woman's Guide to Symptoms of Hormone Imbalance, Why Can't I Keep Up Anymore, A Guide to Regaining Energy, Focus, and Peak Physical and Sexual Performance for Men Over 40. You've also written The Evolution of Medicine. So you were inspired, and we're going to kind of go more into this when we talk about a question of how you were inspired to get into this. But, you were experiencing symptoms of your own that and you felt like you weren't being heard. And so you took matters into your own hand, and you now are on a mission to spread the awareness of having balanced hormones and how it can make you feel better. So not only are you an author, but you've been featured on numerous national radio shows and TV appearances. When I went to your office, I saw all the lovely celebrity photos that you've taken. And so you've completed a 2-year advanced fellowship program in the anti-aging functional and regenerative medicine. And you're a diplomat on the American Board of Anti-Aging and Regenerative Medicine, the Board of Integrative Medicine, and you are a speaker for the examiner for the ABAARM. Perfect. So welcome. Thank you again for joining us. This was my most exciting podcast because I, completed the training with you, and we are integrating bioidentical hormone replacement therapy with weight loss programs at JLox. And again, still just a lot of my patients are don't know a lot about bioidentical hormone replacement therapy, or they feel that they're not being heard within their traditional medicine providers, and they come to me, and so we're just trying to spread awareness within our community size about that, and there is no one better that I could think of than having you on here, so thank you.
Yeah, it's so great to be here. I think this is such a great topic to talk about because there is so much that we can do to help people. There's so many people that don't feel good, and they don't know that help is available. They don't know that the reason they don't feel that good is because their hormones are out of whack.
Right.
And that was my story.
Okay, good. So Christina, as you've met, is my nurse, and she's been on the other podcast as well. So she's kind of just going to ask you a few questions, and feel free to answer or expand on any of those. This is just, a conversation between us, and it's going to provide educational material. So it doesn't have to be cut and dry exactly what we're talking about. So anything that you feel that you want to kind of expand on, feel free to.
Yeah, awesome. Well, thank you so much again, Deb. Pleasure to meet you. Happy to have you. Our first sort of question, just to get in as far as a gateway to talking about the meat and potatoes of hormone replacement therapy. We wanted to know what really inspired you to take that path. Jen mentioned earlier it was a little bit of a personal endeavor, but I would love to hear from your perspective really what sparked that interest, because again, you dedicated so much of your time to thorough certifications and education. So please feel free to share.
Yeah. Well, I was not feeling well. I was exhausted all the time. Napping was my favorite hobby. Like I would revolve my whole day around trying to find a few minutes to just lay down and close my eyes. And at the end of the day, when it was, I have 4 boys, when it was time to put the kids to bed, all I wanted them to do was to go to sleep because I was so exhausted. Like if there was, it didn't matter how much tomato sauce was slopped all over my kitchen floor. It was just going to have to wait until the morning because I had nothing left in me to, mop the floor and clean it up. Mm-hmm. And it went on like that for a long time. And I didn't really recognize that there was anything wrong. I just thought I got 4 kids. Of course, I'm tired, right? But it got to the place where I was also anxious. I didn't used to be anxious, but now I'm waking up in the middle of the night with panic attacks for no apparent reason. And I was so irritable. Like I would find myself just shrieking at my kids over silly little things, like they left their shoes out at the door, or they had the ball in the living room. Like I had no tolerance for it. And I would catch myself with my head spinning around and, flame is coming out of my ears. And I felt like this exorcist voice would come out of my mouth as I'm like screaming at them like a crazy person. And then I felt so guilty because I don't want to be some kind of a monster mom. I mean, that's not the kind of mom that I wanted to be. But the thing that was so confusing is there was nothing in my training that helped me understand what was happening to me. I knew it wasn't normal. My poor husband is the one that bore the brunt of my Wicked Witch of the West impersonation. He used to call from the car on the way home from work, and he could tell by the tone of my voice whether it was safe to come home or whether he needed to put a suit of armor on before he walked in the door, because he never quite knew which version of me was going to meet him at the door. And what changed everything for me is he found a book that was written actually by Suzanne Summers. You remember, right? She was a celebrity on Three's Company back in the 70s. She's like the Thigh Master lady. Yeah. So she's not somebody that I would ever want to get medical advice from. But he found this book that she wrote about women's hormones. And on the back cover, he could see all the things that were me, right? Irritable and tired all the time, etc. And he showed me the book, and, I'm looking at her picture on the cover going like, dude, are you serious? But, I didn't know what else to do. And I knew that I had to do something. And so I read the book. And when I read about all these women in the book and how they used to feel when their hormones were messed up and how they felt now, it allowed me to open my mind. And it really explained all of what I was going through, because I was in my late 30s. Nobody's thinking about menopause when they're in their 30s. But we can start to have hormone changes way before menopause happens. And once I got my hormones back in balance, I just felt like a normal person again. I felt like myself again. And I just couldn't go back to practicing medicine the old way of just, writing prescriptions all day long. So for the last 18 years, I've been helping men and women get their hormones back in balance so they can feel well, they can get off a lot of those prescription drugs and really love the way they feel.
That's great. And I was gonna say, like, so many people think that when they hear hormones, it's only perimenopausal or menopausal women, not your PCOS patient or your PMS patient or men who, nowadays the testosterone levels are lower and lower every year. So I would like, and I try to tell people, like, your vasomotor symptoms are like your hot flashes, and those aren't the only symptoms associated with hormone imbalance. Like, there are so many others. So that sheet that BHRT Academy provides really just gives such a great insight of how many symptoms can actually be related to a hormone imbalance. So I always hand that out to my patients, regardless if they're coming in for an aesthetic treatment or a wellness treatment, because some people, like you said, just don't even know if they're having that and what it could be related to.
Yeah.
And to piggyback off of your point there, feeling so out of body, but so stressed, so overwhelmed, so exhausted. I feel like in today's society, you get the response of, that's just life.
Right.
Oh, you have kids. That's being a mom. That's being a working mom. That's doing it all. That's, versus like getting the empathy and the time and the deserving treatment that it really could, you could benefit from.
Right. Okay, perfect. So now we kind of want to go into, and I know hormones is it's so complex, and there's not just one direct answer. But what we're trying to provide for viewers is just that, the simplicity of, okay, this could be me, this is what I'm thinking, and try to progress more into a comprehensive consult with JLux. So, kind of go a little bit into what are hormones, why are they essential to health?
Yeah. Hormones are chemical messengers. So they are chemicals that go through our bloodstream. They tell our body what to do. They tell our heart rate to speed up or slow down. They tell us to burn fat or store fat. They give us more energy or make us more calm. They control almost everything that goes on in our body. And we have all different kinds of hormones that do all sorts of different things. A lot of times hormones can have kind of equal and opposite actions. So one makes something go up and one makes it go down. And commonly we'll find that women might have one of those hormones that's kind of high normal and another that the opposing one is kind of low normal. And technically they both might be in what we would consider the normal range. But when they're out of balance like that, things don't go quite so smoothly. We don't feel as good as we can feel. We're not exactly sick. We don't have a disease, but we don't feel as good as we could. We're not sleeping as well. We don't have energy. We can't think straight, whatever it might be. We're struggling with our weight. And because it's not a disease, because we're not technically sick, because we don't have a prescription drug that necessarily is going to fix this, it's not recognized. It's not what we were taught about in medical school. What we were taught about is diseases of your hormones. So people who have diabetes or, things like that are what we're taught to deal with. But not so much these changes that happen sometimes because of our age and the time of our life, and sometimes because of stress and toxins and some of the other things that we can talk about that muck up how our hormones work.
Great. And so you kind of touched on the role that hormones play in everyday well-being. Also, hormone imbalance is not just for women, right? So, men are consistently dealing with hormone imbalances, and just because if they don't have a menstrual cycle, doesn't mean that their hormones cannot be unbalanced. And so what age do you find people typically start experiencing symptoms of hormonal decline?
Yeah. Generally speaking, we start to look for it for women around age 35.
Mm-hmm.
So anytime past age 35, our ovaries start to become a little bit less consistent. I heard somebody describe them one time. I thought this was great. Your ovaries are kind of like a bad employee. You never know if they're going to show up to work. Even if they show up, they might not do a good job. They're just totally unreliable. And so things start to change. And generally speaking, our ovaries kind of finish. They conk out. They stop, making these hormones sometime around the age of 52. That's when we really crash off a cliff. But in the years in our late 30s and into our 40s, we kind of have this time of hormonal chaos where sometimes they're high and sometimes they're low, and they can kind of be all over the map. And if the symptoms that somebody's having are menstrual changes or hot flashes, we kind of have a clue that has something to do with hormones. But if it's mood or sleep or other things, sometimes we really have no idea. And especially when you're in your 30s or your early 40s, it's just not obvious that hormones are part of the problem.
Awesome. Okay. And this next question.
I have a question. I'm sorry. I just wanted to go back really quickly. Do you see a stigma that when we talk about male and female, and yes, it's more prominent for females to want to reach out and get help when it comes to hormone imbalance or the idea of just even entering menopause early? Do you see a stigma at all with men who are clearly suffering, but maybe suffering in silence and not getting the help that they need when they need it?
I think there's kind of two problems for men. The first is for women, our hormones, we're kind of used to just over our regular menstrual cycle. Our hormones go up and down the week before our period. We're eating everything in the fridge and, wearing our stretchy pants.
Yeah.
We're sort of used to our hormones are kind of in our face. For men, it's very different. Men definitely have declining testosterone levels, but it's a gradual slide over time. It's not so much in your face. And so a lot of times when men come in, what they'll say is, I'm more tired, I'm more achy, these different symptoms, but maybe it's just my age. Like that's what I hear from all of them. I don't know, I'm not 18 anymore. Maybe this is just normal for my age. So that's one thing is they don't recognize that they could feel better. And then the other is, guys generally don't really love coming into the doctor. So, there has to be some impetus to kind of get them to come. And so maybe they're not feeling completely miserable, but, they could feel a lot better. And I think it's important for them to know that they deserve to feel great. And so if they don't really feel like themselves anymore, help is available.
Yeah.
And so this next one is one that we've talked a lot about in the academy. And so how do bioidentical hormones differ from synthetic hormones? Because I can't tell you how many people have come into me and they're like, oh yeah, I'm on hormones, I'm on birth control.
Yeah.
Or, I'm on Premarin or something like that. And they think, oh yeah, I'm getting the help that I need, but I still don't feel good. Yeah. So just touch on a little bit of the difference of it and why synthetic hormones are not something that, we're trying to use.
So first of all, I want to be honest and say, I learned about this reading Suzanne Somers' book, not at medical school. That was like the first place that I ever heard the word bioidentical hormones. So in medical school, we're just taught about hormones as though everything is just a hormone. But what we were really trained to use for women are synthetic chemicals that were man-made, and they were made to mimic our hormones. So they're not the exact thing as the hormones in our body. And because they mimic our hormones, they're similar to our hormones. They have some of the same actions, but not all of the same actions, and they can have some side effects because they're not quite exactly the same thing. So when we give women birth control pills are synthetic man-made chemicals never found in a human body. They're made to mimic our estrogen and progesterone. But what they do is they turn off our natural production of those hormones, and then they get replaced with the chemicals in the pill that act similarly. But there's a zillion different chemical versions of estrogen and pill, and at what doses people can have very different results.
Right.
And when we started to do hormone replacement therapy, we started to use hormones that often were synthetic, but the main thing is that they're not exactly the same as what's in our body. So bioidentical hormones just means that they're the exact same hormones that our body makes. So at least in theory, our body can't tell the difference between whether the hormones came from the pharmacy or whether they came from our ovaries. They typically start from an ingredient that's found in soy or yam, but you can't like eat yams or eat soy or rub it on your skin and get the hormone. That ingredient has to be adapted in a lab, and it gets turned into estrogen or progesterone or testosterone. But the thing that's important is the end product is an exact match for what your body needs. So there's been a little bit of debate over is one better than the other. We clearly know that there are some risks with the synthetic hormones that we don't see with the bioidenticals. So for example, if you swallow a pill with synthetic estrogens and progestins, that increases your risk for blood clots, whereas we have ways that we can do it with the natural hormones that don't. We know that synthetic progestins, which is the ones that could be associated with a small increase in the risk for breast cancer, are very different from natural progesterone, which has not been shown to increase the risk for breast cancer. So there's a whole variety of reasons why Bioidentical hormones just make sense. We can measure the level of those hormones in your body. We don't have lab tests for the measure of the different chemicals in your body. So we don't have any way to measure things like birth control pills or synthetic hormone therapy. So to me, bioidentical hormones just make sense. If you're deficient in a hormone, we just want to replace the hormone, right? You don't want to eat synthetic tomatoes. Why would you want a synthetic hormone?
Right. Exactly. Okay, and we also have a ton of evidence-based articles on JLuxe's website for if you are interested in taking a look at those. They are listed on a specific page on the website. And so next we're kind of going to go into signs and symptoms, what to look for. So, you know, even if you're not in perimenopause or menopause, listen up, because you could be in your 30s and experiencing these symptoms and have hormonal imbalance. So, Deb, what are some common signs and symptoms of hormonal imbalance in women and men?
Yeah. Can we kind of go by age? Is that okay? Let's start within the 30s and 40s and 50s, et cetera. Okay. So one of the earliest things that women will notice is that progesterone levels drop. And progesterone is the calming hormone. And so if we start to lose progesterone, we can get more PMS. So maybe when you were, 25, you had like 1 or 2 days when you were a little bit emotional or felt a little bloaty or whatever. But now it can be like 5 days, 7 days, 10 days, even 14 days. Like some women only have 1 good week a month. So longer PMS symptoms, worse PMS symptoms of breast tenderness, fluid retention, bloating, hunger pains, emotional all over the place. All of that stuff can be worse. But also women start noticing that they wake up in the middle of the night. So now 2 o'clock in the morning, you're staring at the ceiling and, we can always think of something to worry about, right? And running your grocery list, all your to-dos, all that kind of stuff. So not sleeping soundly is super common, and even starting to have night sweats. And often the sleep and the night sweats get worse that week leading into your period. And then once you get on your period, you start to feel better. And the week after the period is usually a good week. You sleep better, your energy's better, you're going to the gym, you're chopping up your broccoli, cleaning out your closets. And then it kind of goes downhill as your period comes back again. But sleep is a really common one that is often not recognized. And another one is anxiety. So if you are starting to become anxious when you didn't used to be, or if your anxiety is getting a lot more, this could be because of your hormones, especially if it's worse before your period than it is after your period. And then another really big one is irritability. Like your husband is just chewing too loud and you just can't take it anymore. Or, you have no patience with your coworkers or the people on the road that are driving on the wrong lane, or, like we just become more impatient, irritable, critical, negative. Like we just don't have as much tolerance. And all of those things can be a result of low progesterone. And if we can help restore progesterone either naturally or with bioidentical hormones, it just makes us get back to feeling normal again. And we can feel just as good the week before our period as we do the week after our period. And as women get maybe more on into their 40s, another hormone that commonly goes downhill is testosterone. And testosterone is our motivation, our confidence, self-esteem, get up and go, get things accomplished. We think of it as the CEO hormone. You make decisions, and when testosterone goes down, it affects our libido. Like desire goes away, arousal, lubrication, all that kind of stuff kind of fizzles. It affects our muscles and bones. So sometimes women will complain they're at the gym and they're working out so hard, but like they just can't feel it. Like they're, feel droopy and flabby. But then also what I hear really, really commonly is women just say, I just feel kind of flat, kind of blah, like not necessarily sobbing and hopeless in the corner, but just kind of Yeah. And they make their way through their day. They put one foot in front of the other, like they do what must be done, right? They get the food on the table, they get the report handed in because it's the deadline. But if it doesn't have to be today, a lot of times we just sort of procrastinate. We just kind of don't really feel like it. Maybe we don't really feel like socializing with our friends as much as we used to, or, the things we used to really love. We just kind of, and a lot of women really resonate with that. And, they know that it's not how they used to feel, but it's not that they're, like I said, it's not that they're sobbing and hopeless in the corner. They're not exactly sick. They just kind of lost some of that spark.
Yeah.
And again, what happens if you go to the doctor and you say, I'm really irritable all the time, or like feel like I've just lost my spark, or, I just don't feel like myself anymore. I don't feel like doing things. Like, that's just got Prozac written all over it, right? You're going to walk out the door with an antidepressant.
So lost.
Or, you go in and you say, I'm not sleeping. I wake up in the night and I feel like a zombie the next day. What have we got to offer you? Sleeping pills.
Mhm.
But if hormones are really the problem, then the sleeping pills and the antidepressants aren't really the right solution.
Right.
Well, I feel like it's just the Band-Aid approach, like what Jen was just mentioning. Like, you're treating the symptoms, you're not treating the cause. So unfortunately, you're going to have a laundry list of symptoms. You'll have a laundry list of
Potential side
pharmaceuticals
effects,
that are
yeah.
going to be, just suppressing the actual concern.
Yeah. But that's what we were trained to do, like that's quote unquote the standard of care in medicine. Like, if you're not sleeping, we got a pill for that. If your mood is off, we got a pill for that. And then, as if all of that's not bad enough, some point around 50-ish is when our estrogen just plummets to the bottom of the ocean. And estrogen is actually really healthy for women. It's good for our heart, our brain, our bones. It's anti-inflammatory, it's antioxidant. It got a bad rap for wrong reasons that I'm sure we'll get to. But when estrogen goes down, it can cause hot flashes. It can cause vaginal dryness. Those are super annoying and problematic. It can, we can wake up at night with the hot flashes, and then sleep is really messed up. And, nobody feels good, right, if they're not sleeping. But estrogen is so important to our brain. And women will say, like, I feel like I've got ADD. Like, I didn't used to have that, but now I can't focus. I can't keep track of what I'm saying. I can't think of the word that I want. I can't remember people's names and where I parked the car and where I left the car keys and why I walked in the room and what did I even come to the grocery store for. And I think that's the most distressing symptom of menopause. The hot flash is definitely annoying. The vaginal dryness, like the painful sex, we can fix that. But when your brain doesn't work, you can't help worrying, like, are these the early signs of Alzheimer's? Like, can I maintain my career? Like, a lot of women leave the workforce in their 50s because they can't remember things. They can't keep track of things as well anymore. They got to write everything down, and then they got to keep sticky notes to remember where they put their lists. And there's so much effort that goes into keeping track of what they're supposed to be doing that sometimes they just retire. And that's not necessary. Like, we can keep you going. You got lots of life left in you yet.
Yes. And okay, so good. So I was going to ask, like, specificities of age and certain symptoms, and you really did a great job at going over all of that, and the non-obvious symptoms that people can recognize from having hormonal imbalance. It's not just hot flashes, it's not just low libido. Those things are, yes, hormonal imbalance causes, but there are just so many more symptoms that people could be experiencing. So that's really what we want to reiterate, is that if you are not just feeling like yourself and you don't have that spark, hormonal imbalance could potentially be a factor. Okay, good. So we went over that, and now we're going to try to go into like treatment options and delivery methods. And so what are the most common forms of BHRT?
Okay. Well, the good news is we got lots of options. Some bioidentical hormones are available by a regular prescription from a regular pharmacy, covered by your health insurance. Mm-hmm. One of the challenges that I see is, at least, in the past, the regular doctors don't know which ones are bioidentical and which ones are not. And oftentimes the word bioidentical is used to mean compounded hormones. And so these are hormones that come from a compounding pharmacy, which is a specialty pharmacy that personalizes the prescriptions just for you. And we can get them in the form of a topical cream, a vaginal cream. We've got lozenges that dissolve under your tongue. We got all kinds of different ways that we can do it. We can combine hormones together so that we can put whichever ones you need all in one cream. So I really like using compounding pharmacies because I can very much personalize the prescriptions to the woman. Some doctors, many doctors, aren't used to working with compounding pharmacies, and so they don't feel comfortable, and they stick with only the ones that are available from the regular pharmacies that are typically covered by insurance. And that's okay. As long as they're bioidentical, they're bioidentical. We just have a lot less choices and a lot less flexibility. And there is no testosterone available from the regular pharmacies, only men's doses of testosterone, which is 10 times more than women. So more commonly, we use testosterone for women from a compounding pharmacy. So we have topical creams. And the topical creams are nice because we can really personalize and put different, things in the cream. Estrogen comes as a patch, which typically would be covered by your health insurance. And it looks like a little sticker Band-Aid that you put, sort of on your rear end and swap it out twice a week. Progesterone, the natural bioidentical version of progesterone, can come as a capsule. And we actually like the bioidentical progesterone capsules because when you swallow the capsule, your liver processes it and it processes it into a byproduct that goes to your brain, and it's very calming. So the progesterone capsules help the most with sleep, with calming your mood, less anxiety, less irritability. So a lot of women really like that. Estrogen as a capsule or as a pill can be associated with an increase in the risk for blood clots. So it's not a high risk. And depending on like a woman's personal history, generally we're more likely to use a topical form of estrogen so that we don't have to worry about the risk for blood clots. But it's nice to know that there's all kinds of different choices. And one of the things that I tell women is it can get confusing. And sometimes when they listen to podcasts like this or other places, they might hear a doctor say, I really like to do it this way, or I really recommend to do it that way. And then the question is always like, which is the best way? Like, what should I do? And honestly, the answer is that there's not necessarily one best way. And sometimes one way is better for one person and one way is better for somebody else. And some are more expensive and less expensive. Some are more work. So if you're super organized, maybe something that you do daily is great. If you have a hard time keeping up with things, maybe sometimes something you only have to do once a week would be easier for you. So I think it's just nice to know that there's lots of options. And what you want is you want to find a practitioner who will work with you and talk to you about the choices, what's available, pros and cons, risks and benefits, so that you can make the best choice for you.
Yes. Okay, good. And you kind of just said that, how do you choose the right method for a patient? And I think it's really talking with your provider about what your lifestyle is like and what works best for you, and then monitoring the symptoms. How do you feel? Like really saying, how do you feel? Okay, and so how long would you say after someone starts bioidentical hormone replacement therapy that they start to feel a difference? Because this is also something that we talked about in the academy as well. Like balancing hormones is not just an overnight thing, right? So, I really talk to my patients about how it takes time to balance them. It's not just recorrecting progesterone, estrogen, and testosterone. It's taking a look at these stress hormones, cortisol levels, the thyroid, your lifestyle, what you're eating. So how long do you feel your patients on average feel better once you start them on something?
Yeah. Typically, what we tell them is, but within the first 30 days, they should notice something. Like they should have less hot flashes. They should be sleeping. Like they should notice that things are going in the right direction. It probably isn't going to be perfect in 30 days, but like you should know that you're on the right track. Mm-hmm. But overall, it can take several months before we really have you exactly where you want to be. And I think my philosophy, and I think probably your philosophy too, is let's start with some dose of hormone, like a smaller dose, see how you feel, and then we go up on the dose depending on how you're feeling, instead of giving you a big old dose of hormones, causing you to have side effects and having to backtrack. So when we're starting kind of low and moving up, it just takes us a little bit longer before we kind of get to the finish line. But I think people appreciate that kind of approach instead of taking something and feeling crappy, because anything can have side effects, right? Drinking too much water can cause problems. So what we're always looking for is enough to keep you healthy and make you feel good, but without having a lot of side effects.
And then as we're kind of touching base on that, like what are some side effects that you see with, excess progesterone or excess estrogen, excess testosterone?
Yeah. So kind of like Goldilocks, right? We want too much. I mean, if we don't want too much, we don't want too little. We want just right. So for estrogen, we know the symptoms of low estrogen. You're tired, your brain doesn't work, your skin is dry, you leaking urine, but too much estrogen can definitely cause side effects. Commonly, it could be breast tenderness, fluid retention, bloating, kind of feels like PMS. Mm-hmm. So if all of a sudden you feel like, I feel like my period is going to come, it probably just means it's a little bit too much estrogen for you. And so we could back off a little bit. It also could mean that we don't have the balance between the estrogen and progesterone. So it might just mean that we need a little bit more progesterone to balance it out so that you don't have those side effects.
Right.
For progesterone, if progesterone should minimize PMS symptoms. So like if you're in your 30s and 40s and you're still having your period and you have PMS, oh my gosh, progesterone can be like the greatest thing ever. I remember the first time I started on progesterone, it was like, it's like the heavens open, like nature's version of a glass of red wine, or I don't know, a Xanax or something.
Right.
Like, it's so calming. But we need a balance between the estrogen and progesterone. If it's too much progesterone, it can cause similar symptoms. It can go the opposite direction, a little bit of breast tenderness, fluid retention, bloating. So that's why you need to have a provider who's going to work with you to help you sort it out, not just somebody who's going to give you a prescription and say, see you next year, and then you're kind of on your own.
Right.
If we give you progesterone in a capsule, it's nice and calming, right? You sleep nicely. But sometimes for some women, they don't respond well to it, and it's too calming. And so then they feel drowsy or kind of heavy or kind of down. And that's not what we're going for. And sometimes if women are very sensitive to the progesterone, sometimes they do better with a topical cream instead, because it doesn't have the same brain effects. Testosterone, the side effects are just super annoying. Like oily skin or oily hair, like now you feel like you have to shampoo more often. But on the other hand, a lot of women with low testosterone have dry skin and dry hair, so it just makes it better.
Right.
It can cause a pimple here or there. So, especially for women who are a little prone to acne, we got to have a light touch. And it can cause hair to grow in the places that you don't want it, like, on your lip, for example. And what we really find is, as long as we have this conversation up front and we just talk about it is what it is, we find that that's not usually a deal breaker for most women, because we're used to dealing with unwanted hair, right? Shaving our armpits and all that kind of stuff. So, and a lot of women have to deal with hair on their face without any kind of hormone therapy. So if you feel great, if you have a great sex life, if your mood is uplifted and, you just feel like yourself again, maybe you're going to be willing to tweeze or wax or, whatever. And if you hate it, we can stop it and it melts away. And, it's not a dangerous thing. It's just annoying. And then one other thing that probably we should mention is, if we give menopausal women estrogen, sometimes we can cause uterine bleeding, because the estrogen is helping your skin to be healthier and your bones to be healthier and your heart to be healthier and your uterine lining. And so sometimes it can cause some spotting and bleeding. And that's not what we want. That's, if you think your period is done, who wants to have to deal with spotting and bleeding? But again, it's usually it means we need a better balance between the estrogen and progesterone. And we also just have to be really careful that we don't dismiss it, because that could also be how women present if they actually have uterine cancer. So we don't want to ignore it and just say, oh, it's just the hormones. We got to just make sure there's not some other problem going on.
Right. And then, in the academy, we always talk, with the patients that come to JLux too, like, have your yearly PAPs and your mammograms and, have your baseline levels so that, we can kind of refer back to that. And always working in a close relationship with an OB or a women's specialist is important too. So, although complex, we can all work together in order to make everything harmonious. Yeah. And so now we kind of go into this topic that's really, I find, the most important, because not so many people understand it. Because like you said, hormones got a bad rap. I cannot tell you still, and I'm sure you too, how many people come in and say, oh, my OB said that hormones cause cancer and I can't be on it. And, so we're going to kind of talk about the evidence, outcomes, and myths associated with BHRT. So I know there is so much research now that is coming out about the benefits of BHRT, but kind of touch base on, where did it go wrong in the community? Like, why are people still saying that hormones cause cancer? And again, just touch on it, right? Like you did a little bit before, like, hormones are good for your brain, your gut, your heart, your ovaries, your breasts, so go into the study where it went wrong.
Yeah. So when I was in medical school in the 90s, we were taught that hormones were the greatest thing since sliced bread. We wanted all menopausal women on hormone therapy to protect their heart, their brain, and their bones. And then in 2002, a study came out that said, causing breast cancer. And as doctors, we were horrified, right? Like, we were so mortified that we were doing something that was causing our patients to have breast cancer, that overnight hormones went from the greatest thing since sliced bread to like bad, dangerous, don't touch it with a 10-foot pole. And even though that study has been debunked, We know that that study claimed that estrogen was the problem, but in fact, the women on estrogen in that study had a reduction in breast cancer, not an increase. It was the exact opposite of what we've been telling women for 20 years. It was only the women who had a combo pill where they were given estrogen plus the drug form of progesterone. They had a teeny tiny increase in the risk for breast cancer. If they weren't on any hormones, their risk was 4 in 1,000. And if we gave them that kind of synthetic progestin pill, the risk was 5 in 1,000. So from 4 in 1,000 to 5 in 1,000, that's less than 1%. That's like, and that's rounding up. It was really like 7 in 10,000. So teeny tiny risk only with the synthetic progestin pill, not with the estrogen alone. But for reasons that I can't even understand, it was seared into doctors' psyche that estrogen is dangerous. And that was 20 years ago. And even the very same authors of that first study have come out, they've published over and over again. They are the ones saying the women on estrogen did better. In fact, they said that women who were on estrogen therapy were less likely to die from breast cancer. And this is the only prescription that we have that actually reduces death from breast cancer. That's from the same authors that studied, that published that initial study. But it doesn't matter how many times it's published. It's been so difficult for doctors to change their thinking. So the reason that women are still to this day scared of hormones causing breast cancer is because doctors are still telling them, because it's the doctors. I'm even in some Facebook groups with other women doctors, and they will sometimes say, oh, I have all these symptoms, I'm going through menopause. I'm scared of hormones. What should I do? Like, doctors are trying to help other doctors because doctors are scared of hormones. This is a myth. It shouldn't be. They should be reassured, but they haven't read all the studies. And the media doesn't really run with it because it's really juicy media reporting to say that hormones cause breast cancer, right? If we've got fear, that makes for good news. But if it's reassurance, it's fine. It's going to help you. You don't have to pee your pants or have painful sex or get shriveled up and wrinkly like an old lady or gain 20 pounds or forget, like have your brain fall apart and your career implode. You don't have to have any of that. And hormones aren't dangerous. I wouldn't recommend the synthetic progestin pills, but we've got alternatives. And so there's just no need to suffer. So this is like my mission, is to help women understand that you don't need to suffer. You don't need to be scared of hormones. What you do need is you need to work with somebody who's going to talk you through it and help you understand. We all have our own risks and benefits. There's risks and benefits for everything. But for the vast majority of women, the benefits of the hormones far outweigh the risks. And they can help you to stay healthy, live longer, look better, feel great for so many more years.
And yeah, that's amazing. So another one that I want to address, because again, these are patients that are coming in. What about the women that are 5 to 7 years postmenopausal and their OBs are telling them that, right now it's just too late to kind of go on. I know different providers have different ways to treat this. And I just wondered your thoughts, because I know through the academy you had said it,
Yeah. Okay. So the reason that some women are being told that it's too late for them to be on hormones, partly is because of this fear of the hormones. And so the mindset became, use the least dose for the smallest time necessary, only when it's like somebody's really, really, really suffering, and then get them off it as soon as possible, which, has been thoroughly debunked. But also in the study, the women who were older did have more risks from those synthetic pills. Partly, it wasn't even breast cancer. There was no increase in breast cancer as the women got older. It didn't matter how old they were. And there were no increase in deaths, even though there was a teeny tiny increase in the risk of getting breast cancer with the synthetic progestins. There's no increase in the risk for death from breast cancer, but there was a reduction in colon cancer, lung cancer, hip fractures, osteoporosis, and death from any cause. So you were more likely to live longer, even on those synthetic pills, than you were if you were not on any hormones, but that doesn't get publicized. But so it is true that women who were older were more likely to have the blood clots from taking these synthetic pills, because as we get older, we're at greater risk for blood clots.
Anything, right.
And so if you get a blood clot in your heart, it's a heart attack. A blood clot in your brain is a stroke. So it seems logical that, maybe we shouldn't be giving it to older women. But what we know is that if we give it through your skin, we don't have an increase in the risk for blood clots. And so we are able to give you hormone therapy without increasing your risk for blood clots. We know that especially if we're giving vaginal hormones to women, it doesn't matter how old you are. There's no, even women who have breast cancer can have vaginal hormones, or who have had a history of breast cancer. So there's no need to have the painful sex, the vaginal dryness, the urinary tract infections, all of that kind of stuff. So it is still very much considered the standard of care in medicine that any woman who is 10 years past menopause or over the age of 65, that they're told that it's too late for them. I don't believe that that's true. I might do things a little differently if somebody is older compared with if they're younger, but I believe that all women deserve the benefits of hormones. We get the best results if we start it around the time of menopause and use it going forward because it's preventive. If we start it later, it doesn't go backwards and erase, whatever degenerative changes of the age have happened, but it still helps with bone health. It still helps with, vaginal health and urinary health. It still has benefits. We just need to do it in a way that doesn't increase your risk for blood clots.
And really quick, and that's what I want to touch on too, so that people know, but hormones are not just treating a symptom of vasomotor or libido. From the long-term effects of hormones, it is improving osteopenia, osteoporosis, macular degeneration, degenerative changes within the brain, urinary arthritis, urinary incontinence, sexual dysfunction, and not just dryness, but like you said, painful intercourse. So the benefits long-term, because I've had some people who have said, and they're not having vasomotor symptoms, right? They're like, oh, I don't feel like it. And then I try to tell them, we're trying to protect your body from the degenerative changes that come after the hormones. So although you may not feel bad, or, you are sleeping okay, what we're trying to protect is the loss from your bones and the loss from your brain. So, my stepmom, for example, she's 7 years post-menopause, and, I was telling her about all of the benefits of hormones and how she should really be on it. And it's not too late for her. She has osteopenia. And, when she went on the patch and progesterone, she's like, I don't feel a difference in my symptoms. And I'm like, that's technically not what we're looking for. Right now, we're looking to preserve what you have without more loss. And so I think sometimes it's hard for patients to understand that, it's not a pill that's taking care of a symptom per se, but the benefits of it long term are also just as important as those that are taking care of the sleep disturbance and the hot flashes.
Because for the last 20 years, right, doctors have been telling women to stay away from hormones, and so now we've got this whole generation of frail little old ladies with walkers in nursing homes, and much of that could have been avoided if we had given them hormones.
Not to mention the people who do have symptoms and approach their doctors. And I can't tell you how many people are like, well, they just told me, welcome to menopause. This is menopause.
This is just your age.
You have to live from now on. And 2/3 of our life are spent in menopause. So, it's a little disheartening as someone who is not feeling well to know, oh my gosh, I'm going to live the next 30 years potentially feeling like this.
Yeah. So, I talked to a doctor who, she for many years was a family doctor, and women would come in, they'd complain of these menopausal symptoms, and she'd say, oh, it's just menopause. The symptoms can last for 7 to 10 years, and then they should go away, and she'd kind of blow them off. And then she started going through it, and her doctor said, it can last for 7 to 10 years, and she was like, oh, hell no.
Right.
I'm putting up with this.
Changes when you're going through it, for sure, and you can speak to it. And, I think that's a lot what we talked about in the academy, really, touch on how you have felt personally, and then you can connect with your patients. So that's really important. So what would you say the biggest misconception about hormone therapy is? Do you think we kind of touched on that with the cancer?
I think the biggest misconception is that hormones are dangerous and that you are safer, better off, more likely to be healthy if you stay away from hormones, when in fact that's the exact opposite. I think it's good to know that it's always a choice. Nobody has to be on hormones. It's a choice, sure. But it's just wrong to stay away from hormones out of fear. And doctors have done this, and it's us medical providers that need to change it because we're still giving women wrong information.
I had a question. Just we're talking so much about, you know, the menopausal age and women in their mid 30s, and is there any use for bioidentical hormone replacement therapy for those that are not truly adolescents, but maybe late teens, early 20s, where maybe they're struggling? I have also read some research that, you know, again, with brain fog and attention span and some of those college students that are really struggling with the ADD that's attacking their brain, or, you know, the women, I should say women, but yeah, the younger adults there too that don't have regular cycles, but they want to attack that earlier on, knowing that infertility is such a big issue in today's society. So I was just curious of your thoughts on that age range. And I know we only have about 10 minutes left, so feel free to give a quick
Yeah.
overview of it, but it was just something that always has been top of mind for me.
So you've opened a whole Pandora's box here.
Sorry.
No. So when girls start to, you know, have their periods, it takes sometimes, you know, a little bit of time before their ovaries kind of get up and running. But it is extremely common for young women to have very heavy periods and painful periods and a lot of problems and staying home from school with the, you know, hot packs on their abdomen and all of that. And then usually by the time they're kind of in their 20s, it's kind of at least stabilized out a little bit. But it's happening a lot. And you know, even women in their 20s and infertility, there's so many hormone imbalances because of toxins in our environment. A lot of the chemicals, plastics and pesticides and things that we're exposed to are hormone disruptors, which means they're chemicals that mess up our hormones. The food that we're eating is not healthy. It's devoid of a lot of, you know, nutrients. It's very processed. And so if we're not getting the right vitamins and minerals, we can't make the hormones that we need. Eating a lot of sugar and starchy carbohydrates, the blood sugar spikes throw our hormones right out of whack. They cause a lot of inflammation. When we're stressed out, we didn't even talk about cortisol or thyroid today, but when we're stressed out, cortisol goes up. That's our stress hormone. And cortisol regulates a lot of things. It regulates our immune system, our sleep-wake cycle. So we're sleeping well at night and awake during the day. It regulates our blood pressure, our blood sugar, and it regulates all our other hormones. So when we're really stressed, our other hormones get knocked out of whack, and women can have more, you know, PMS and hormone problems and infertility. There's so many things in our modern world that impact our bodies and impact our hormones. And so, you know, women and you know, boys like ADD and low testosterone and very young men, they've got all these symptoms, but when they go to the doctor and they describe their symptoms, we treat their symptoms. We give them sleeping pills, anxiety pills, antidepressants, ADHD medications. Like, we'll have college students come in and they're on 5 different medications that are all impacting their brain in different ways. Mm-hmm. And the underlying problem may have been that chronic stress and, you know, the environment that they're living in and staying up all night and all these kinds of things knocked their hormones out of whack, so they felt bad. But the treatment doesn't need to be bioidentical hormones. It's not that they can't make hormones, and the treatment certainly doesn't need to be antidepressants specifically. But if we can help them do better with their lifestyle habits, etc., it can make such a big difference. And so, I don't know. There's a really big kettle of fish, because that young person has to want it, right? They have to be the one that eats healthy and goes to bed on time and takes care of themselves. It's so much easier to just give them a prescription for an antidepressant.
Right. And I think we teeter on, like, you know, bioidentical hormones, but like functional medicine too, you know, focusing on the lifestyle, overall gut health. And like you said, you really have to want to feel better if you're going to kind of dive into the functional medicine world, because all of that relies on work, consistency, determination, time, working with a close provider. And
prioritizing yourself, right? Prioritizing you, not just doing for everybody else and putting yourself last.
Right. Well, good. So I think we really talked about a lot of things. So we're kind of just going to approach like the final advice and closure time. You know, obviously, what do you think someone should do if they need hormonal support? So if anybody connects with some of the symptoms that we've been talking about today, you know, finding a provider that is, you know, well versed in hormones. It doesn't have to be an OB. It doesn't have to be a primary care provider. So reaching out to people who focus on bioidentical hormone replacement therapy and functional medicine is also, I feel like, going to help get a clearer picture of why you could be feeling the way that you're feeling. Also, like specific tests, that we, test hormones out, it could be blood, it could be Dutch tests, it could be saliva tests. So there's a lot of different options and availabilities that we have in order to help patients. Is there anything that you want to add that we didn't touch on that you feel would be beneficial for viewers that are watching the podcast?
Yeah, we all need to take responsibility for our own health. And the good news is that a lot of this is within your own power. And, you can't just rely upon your doctor to give you a pill, even if it's a bioidentical hormone pill, right? So, but that's good news. There's a lot of this that's within our own power. Find somebody that can help you and do take care of yourself, because I really believe that living well is the best medicine.
Absolutely. Thank you so much, Deb. It's been amazing seeing you. We really appreciate you. And if anybody has any questions about the podcast and you want to mention it in your appointment or schedule an appointment to discuss this, you will receive 10% off of your consultation in order to do so. And we will have clips of the podcast and the video up on the website as well as on Instagram and Facebook.
Can I maybe really quickly offer something else that might help women?
Sure.
If they're not like 100% sure if hormones could be the problem, like they're wondering, they can actually download a free copy of my book. And it has a lot of quizzes, like could it be low cortisol? Could it be low estrogen? Could it be high testosterone? That can kind of help. And that way you can kind of, know that, yep, it seems like my hormones are out of whack. And then you'll know that you need to call and make an appointment. And you can get a free copy at isityourhormones.com.
Perfect. And we'll put that on the Instagram post as well, so that if you are watching the video and you want to click on it, we can add that. But I'm going to incorporate that in, Deb, so everybody can do that. I did not take that in. Well, thank you so much. Have a great day. I know you're so busy. We'll be in touch, and we super appreciate you.
Thank you so much, Deb. Pleasure to meet you. Enjoy the rest of your day.
Thanks. Bye.
Bye.
Bye now.